Hi, and welcome to this week's video podcast on the sacroiliac joint. I'm Brent Dodge, owner of Alpine Physical Therapy, and I've been treating low back pain and sacroiliac joint problems for 19 plus years. SI stands for sacroiliac, and that is a joint that is formed at the base of the spine where a triangular bone called the sacrum connects on each side to the pelvic bones to form the sacroiliac joint, one on the left and one on the right. So when I use the words SI joint, I'm talking about this unique set of joints at the base of the spine that can be quite an enigma, because a lot of times when people have low back pain, there may be a component of pain in that lowest area of the low back, the SI joint. And it becomes confusing a lot of times because it's hard to differentiate whether a person's problem is coming from the low back proper or whether this is an SI joint problem, or perhaps both are at play. So in terms of anatomy, at the base of the spine, again, we have one joint on the left, one on the right, the sacroiliac or SI joints. This is a joint that is surrounded with a lot of tough ligaments. Ligaments join bone to bone. And some of the toughest and strongest ligaments surround the SI joints. What's unique about that is to have a significant injury to that area, something needs to impact those ligaments. There are certain types of trauma that could certainly impact the SI joint. And as a result end up with ligament sprains or ligament tears in this area and create an SI joint problem. On the other hand, particularly in pregnant women, there is a hormone that's released called relaxin, which can actually begin to allow the ligaments to stretch, at which point there can be changes within the joint and the person would end up with SI joint pain or dysfunction. Otherwise, you have to stand back and say, why is the SI joint causing pain in this particular case? Is it because this is a pregnant female that has relaxin, that hormone in her body? Well, if not, was there some significant trauma that may have produced injury to the ligaments? If not, why then is the SI joint creating problems? Well, there are certain conditions, systemic conditions in the body that can occur, as for example, rheumatic conditions that can manifest as pain in the SI joint. And that's something that needs to be cleared in a clear history taken by the doctor and the physical therapist. That is a different treatment plan than typical treatment for an SI joint problem. Now, if someone were to step off of a curb, for example, and have a sharp jolt to the leg, it's possible, some people would argue, that there could be a small amount of movement within the SI joint, not necessarily a tearing of ligaments or even a bad strain to a ligament, but more a change within the joint itself. Now, others would argue that no movement occurs at this joint. I believe that a small amount of movement can occur, and it's those small amounts of movement that might occur from a jolting experience, for example, like I mentioned, a step off a curb, that could then begin to manifest as SI joint pain. Not forgetting the fact that people with low back problems, such as a herniated disc, a low back joint problem, may also have compensation that goes on in the low back, leading to pain and symptoms in the SI joint. So you can see the work of a physical therapist gets pretty complicated in that we need to define, is this a problem with the low back, or is this truly an SI joint problem? Some fantastic news that's come down the pike lately in terms of research is what's called a clinical prediction rule. These are helpful tools for doctors and physical therapists because we can use the clinical prediction rule to determine if we have an SI joint problem. In my practice, I run about 5 or 6 different tests depending on what I'm finding in the exam. Very simple tests that we can use to compress the leg, to put pressure on the pelvic bones, to test with a leg lifted whether that's recreating pain. These are all validated tests that we use, and we put them as a clinical prediction rule to say if 3 out of 6 of these tests are positive, there's about a 60% chance that I can treat that SI joint successfully. Now obviously, if more and more and more of those tests are positive, for example, all 6 of 6, I can pretty much guarantee that a treatment to the SI joint is going to have a good clinical result. And that's great information for clinicians. It's great information for clients. And as part of the treatments that we do at Alpine Physical Therapy, we go through the clinical prediction rule to determine, am I dealing with an SI joint problem, or do I have a low back problem that I need to further identify, or perhaps a combination of both? That will help dictate the types of treatment that we do. Now, there are a variety of treatments that can be done for SI joint problems. If we're dealing with the population of people, the pregnant mother who has relaxin that's flowing through her system, we're not going to want to get in and do heavy manual therapy, moving the bones and joints of that area. We may do very gentle types of treatments to help her be symptom-free, and then perhaps 2 to 3 months after her delivery, when her relaxin has gone out of her system, we can then begin working with the joint, making sure we get it back where it belongs through mobilization, which is joint movement, or manipulation, which is a high-velocity physical therapy stretch, if you will, that will reset the joint, reset the nerves, and abolish symptoms. So that's something we'd probably want to wait to the, when we're ready to get back in and begin working with those ligaments, rather than when the relaxin could put them at risk. Women who are dealing with low back and SI joint problems during their pregnancy may benefit with a low back belt, a corset that can actually help support the baby and put some gentle compression through the sacro-iliac joints. Other people who have SI joint problems, again, maybe somebody stepped off of a small step, they feel pain directly over that spot, the SI joint, and they fall into the clinical prediction rule. There's a very good amount of literature that suggests that they're going to get relief with a sacro-iliac joint manipulation. And that word manipulation in manual medicine simply means that we're going to put a force through a joint or soft tissue that really the patient isn't going to control. It's into the hands of the physical therapist or other manual therapists, such as a doctor of osteopathy, a chiropractor, somebody that's going to be doing that manipulative treatment. With the treatment to the SI joint, what we're trying to do is basically separate the joint momentarily and reset the position of the SI joint. And in doing so, taking some strain off the ligaments, resetting the nerves, helping everything to relax in that area, getting those muscles to finally get a chance to relax. There's great evidence that suggests if we do the manipulation to the SI joint, we get an immediate response in the muscles around that area so that those muscles can actually begin working better. And that's good news for people that may require and then undergo a manipulation. Other types of treatment for SI joint problems can include mobilization treatments. These are treatments where we're gently trying to move the pelvic bones where they meet the sacrum to help reposition, to help provide some nutrition and lubrication to the joint, and to reduce pain input. And by doing so, oftentimes we can help people learn a stretch that they can take with them so that they can manage their pain and feel better. Another type of treatment for SI joint problems is support. First of all, we talked about manipulation, now mobilization, and now support. If you can think about those wedge-shaped joints in the back of the lowest part of the low back, sometimes putting some pressure around those joints will help, particularly if there's been a problem with the ligaments where the ligaments aren't holding well. We call that an instability. By putting the compression through the pelvis, people can actually feel relief and begin doing their daily activities and exercises and so forth with less pain. When you have less pain, your muscles tend to work better. Then we can work on rehabilitation for those muscles and make sure that we get you back on track. The other thought process is that if we can compress the joint and take the strain off the ligament, we can actually see a shortening in the strained ligament that will then be able to hold that joint steady, and now we have what was an instability now becomes more stable. There are other types of medical treatments, including one called prolotherapy that some doctors will use. It's an injection of a sugar-based substance into the ligaments that will then shorten those ligaments and stabilize those ligaments. Once we see people that are getting good results with the belt support, where we're compressing the joint, they may become a candidate for prolotherapy. And you can find out more information on prolotherapy by Googling Prolo, P-R-O-L-O, therapy, or talking to your doctor about it. If you have additional questions on SI joint dysfunction, I encourage you to visit the patient resources section of our website, alpineptmissoula.com. In the list that you'll find there under lumbar spine is a document called Sacro-Iliac dysfunction. This will highlight much of the information we discussed here and provide an even more detailed talk and discussion about SI joint dysfunction. If you have any other questions, be sure to visit our website and call our clinics.